Hi, students. This is your favorite lecturer, Mr. Paul Fagwai. Yeah, it hurts me. It hurts me when I see students failing in mental health. It pains me a lot, and that's it's not things we have to blame everybody. No, as you are aware, is that mental health and psychiatric nursing is surrounded by stigma, and a lot of students are not interested to hear about this course. So what I've seen is that a lot of students struggle to write the management of psychiatric conditions. So I would like you to invite your friends to come to this page so that because I'll be offering free lessons on this page, what you need is just to have bundles. So today we'll mainly talk about most of the times when the question comes during the exams, they will tell you that Mr. Gwai came to Shanama Hospital to ADE with history of anhedonia, which is a lack of interest in the previous pleasurable activities, also not eating for 2 weeks, and the diagnosis of depression was made. They will say, discuss the management of Mr. Gwai. So when the question comes like that, it means they're telling you to write both medical as well as the nursing management. So how do we write the medical management? First of all, as a student, you have to write the aims of that management. Remember, you are dealing with depression. So you write your aims. From there, you can write about 3 or 4 points. You say your aims to relieve the symptoms of depression. That will be your aims. And also to promote the safety of the client and that of others, and also to relieve anxiety. Remember, 3 M's. Then when it comes to the actual management, that is medical, you have to bear in mind whereby when they say write medical management in psychiatry, you have to write 2 things in medical management, and that is the pharmacotherapy, the use of medication to manage depression, and also non-pharmacological, which is psychotherapy. First of all, I will talk about the medical management of depression. You have to write 3 drugs. Only 3 drugs you are going to write the drug itself, indication, the side effects, and the next implication. So first of all, when the question comes, write the medical management of depression in brackets pharmacological. You are going to choose the drugs. Remember, in depression, the groups of the drugs are about 5, but mainly there is the selective serotonin reuptake inhibitors, there is the tricyclic antidepressants, there is the monoamines oxidase inhibitors, there is the norepinephrine serotonin reuptake inhibitors, as well as there is the atypical antidepressants. Most of the times in the Zambian setup, we choose the first lines, the SSRI. So we are going to choose one drug from whichever group C of antidepressants mainly. So like for here, we are going to choose the first line antidepressants medications. We are going to choose from the SSRI. And remember, under SSRI, we have fluoxetine, we have paroxetine, we have cytopran, we have acetopran, we have sertraline. So we're going to choose the drug which is commonly used in Chinama. We're going to choose fluoxetine. So we're going to give fluoxetine 20 milligrams or D, first of all, for 2 weeks per oral. And then indication for fluoxetine. It is given in anxiety disorders, it is given in depression, it is given in sexual disorders. Side effects of fluoxetine, it will be insomnia, retarded ejaculation, as well as weight gain. Next implication, you ensure that this drug is not given in the night because it causes the insomnia. Wasiriza fluoxetine pacha. Then remember, when somebody is depressed, some patients with depression, they come with delusions. And once they come with delusions, it means you don't necessarily just write one drug for antidepressants. You also get one drug from antipsychotics. You can choose, like for here, we are going to choose the drug of high potency, and we are going to choose the haloperidol. So haloperidol, it will depend on how severe that condition is. You are going to choose haloperidol. For a start, we can give maybe 2.5 milligrams or 5 milligrams or D per oral for 2 weeks. Indication for haloperidol: it is given in schizophrenia, it is given in mania, it is given in depression. Side effects: you can choose from the general side effects or specific side effects. So for here, we can choose the side effects, the specific ones which are so helpful to our clients. We're going to choose acute dystonia. We're going to choose pseudopanxanosm. We're going to choose akathisia. Nursing implication: it is always important to explain to the client the possibilities of extrapyramidal side effects. The last one: once you give haloperidol, it means there is a possibility of a client developing the extrapyramidal side effects, and therefore you have to choose one drug which is going to relieve the side effects of those extrapyramidal side effects. So in this case, you are going to choose the drugs which belong to the groups of anticholinergics. You are going to choose ateni. Yes, so ateni, also known as benzexo or trihexyphenidyl. This drug, most of the times, it is given PRN, or which is also known as whenever necessary, or it can be given ateni 5 milligrams OD for 5 days. Indication for ateni: it can be given in a client who has got EPSs. Side effects: dry mouth, weight gain, yes, and also euphoria. Nursing implication: this drug should not be given to the client in bulk because there is a possibility of a client abusing that drug. Remember, I'm sure you have seen a lot of people abusing ateni because it causes bemushe. So 3 drugs which you're supposed to write in terms of medical management: 1 antidepressant, which is going to relieve the mood of the client, and also 1 antipsychotic, which is going to cater in case there is any psychotic symptoms. And also the last one, because once the antipsychotic is given, in case of those with hypotension, there is a possibility of a client developing extrapyramidal side effects, and therefore you have also to add 3 drugs. Then from there, manje hapo ubwera manje non-pharmacological. You talk about psychotherapy. This can also be known as counseling. There, ungafaka 2 points. Because ukapasa patient medications, these clients are not aware, they lack insight. So the moment you say, you advise the client that mkazimwa mankwala because this condition, for you to get better, you need these medications, it means you are doing psychotherapy. So in terms of medical management, you have to write pharmacotherapy, which is the use of medications, and non-pharmacological, which is psychotherapy. In China, no, when a patient is seen, the psychotherapy is done by specialized people, the psychologists or the psychosocial counselors. So I'm sure for the medical management, I'll end here. Tomorrow I will come and we'll be discussing about the nursing management. So if you write like that way, it means you would have given 15 points. You can get all of them 15 marks. Yes.